If you have IBD, whether it's Crohn's disease, ulcerative colitis, or another form of inflammatory bowel disease, you've probably noticed that certain topics are rarely discussed. One of those topics is fertility. This might be a conversation that's been brushed aside by your doctor or only briefly mentioned during a consultation. The truth is, IBD can affect both men and women in unique ways when it comes to fertility, and today, I'm going to dive deep into what you should know. I'll also discuss the role of medications and give you some tips to help improve your fertility if you're planning for a family. Let's get into it. How IBD affects fertility. If you have IBD, you might be wondering, how does my condition affect my ability to have children? Well, the reality is that the effects of IBD on fertility can vary from person to person. However, there are several common factors that might affect fertility, and understanding these factors can help you plan ahead. Chronic inflammation. One of the main issues with IBD is that it causes persistent inflammation in the digestive tract. This inflammation can affect nearby organs, including reproductive organs. In women, it can lead to scarring of the fallopian tubes or the ovaries, which might result in infertility. In men, chronic inflammation can affect sperm production and function. Surgical impact. Many people with Crohn's or colitis eventually require surgery to remove damaged parts of the intestine. If you're a woman, surgery around the reproductive organs or bowel may lead to the formation of adhesions, scar tissue, which can block fallopian tubes and affect fertility. Surgery to remove part of the intestine in men could reduce blood flow to the testes, impacting sperm quality and production. Nutritional deficiencies. IBD can interfere with nutrient absorption, leading to deficiencies in important vitamins and minerals like folate, iron, vitamin B12, and zinc, nutrients that are essential for reproductive health. Deficiencies can cause menstrual irregularities in women or reduce sperm count and motility in men. Hormonal imbalances. Both men and women with IBD often experience hormonal changes due to stress, malnutrition, and the body's response to chronic inflammation. In women, these imbalances can lead to irregular menstrual cycles, which can complicate conception. Impact of medications on fertility. Now let's talk about the role of medications in fertility. While medications like biologics or immunosuppressants are essential for managing IBD symptoms, they can sometimes impact fertility in unexpected ways. Here's a breakdown of the most common medications and their effects. Corticosteroids, e.g. prednisone. These are commonly prescribed during IBD flare-ups. Corticosteroids work by suppressing the immune system and reducing inflammation. However, long-term use can interfere with fertility. Steroids may reduce sperm count in men and cause irregular periods or disrupt ovulation in women. Immunosuppressants, e.g. azathioprine, mercaptopurine. These drugs help suppress the immune system to prevent the body from attacking itself. While effective for managing IBD, they can impact fertility by reducing sperm count in men or affecting egg quality in women. It's recommended that you discuss fertility plans with your doctor if you're on these medications. Biologics, e.g. adalimumab, infliximab. Biologics target specific immune system pathways, and they are often used when other treatments are ineffective. The good news is, biologics appear to have little to no effect on fertility. However, as with all treatments, it's important to have a discussion with your healthcare team about potential risks when planning for pregnancy. Methotrexate, a potent immunosuppressant. Methotrexate is sometimes used in IBD treatment but is known to cause birth defects. It can affect fertility in both men and women. It is recommended that both men and women stop taking methotrexate for at least 6 months before attempting to conceive. 5-ASA drugs, e.g. mesalazine. These drugs are generally considered safe when it comes to fertility. They do not interfere with egg quality or sperm production. However, it's still important to keep your doctor informed about your fertility goals. Fertility in men with IBD. While much of the conversation about fertility tends to focus on women, men with IBD face their own set of challenges when it comes to reproduction. Sperm quality. One of the major fertility concerns for men with IBD is reduced sperm quality. Studies show that men with Crohn's disease or colitis may have lower sperm count and reduced sperm motility, especially if they've undergone surgery or experienced long-term flare-ups. Chronic inflammation in the intestines can also affect the body's ability to produce healthy sperm. Erectile dysfunction. Men with IBD may also experience erectile dysfunction due to the physical discomfort of the disease, the stress it causes, or as a side effect of certain medications. While erectile dysfunction doesn't directly cause infertility, it can obviously complicate conception. Surgical impact. Surgery is sometimes necessary for men with severe IBD, and depending on the type of surgery, fertility can be impacted. For example, surgeries involving the bowel or rectum can affect blood flow to the testes, leading to decreased sperm production. Fertility in women with IBD. For women with IBD, there are unique challenges when it comes to fertility. While many women with IBD can and do successfully become pregnant, being aware of the challenges and preparing your body is key. Fallopian tube blockage. As mentioned earlier, chronic inflammation can cause scarring that might block the fallopian tubes. This could prevent the egg from reaching the uterus and make it harder to conceive. Additionally, surgeries related to IBD can cause adhesions around the fallopian tubes or ovaries, further complicating the process. Ovulatory dysfunction. Women with IBD may experience irregular periods due to malnutrition or the hormonal disruptions caused by inflammation. Irregular ovulation can make it more difficult to predict when you're fertile, which can delay conception. Pregnancy risks. Women with active IBD may face higher risks during pregnancy, such as preterm birth, miscarriage, or low birth weight. This doesn't mean you can't have a healthy pregnancy, but it's important to manage your disease carefully with the help of your healthcare team. What your doctor might not tell you. Here's where things get tricky. Your doctor may not always have the full picture when it comes to fertility and IBD. There are a few important things that might not be discussed in your routine visits. The impact of stress. Chronic stress from managing IBD can affect fertility. Both men and women with IBD are often under high levels of stress, which can impact hormone production, ovulation, and sperm health. Stress management techniques like meditation or yoga can help mitigate some of this. Nutrition and fertility. Poor nutrition is common in people with IBD due to malabsorption. If you're deficient in key nutrients like folate, iron, zinc, or vitamin D, it could negatively impact your fertility. Working with a nutritionist who specializes in IBD can help you optimize your diet for better fertility outcomes. Preconception planning. Many IBD patients don't get enough guidance on preconception planning. It's important to be in remission before trying to conceive, as flare-ups during pregnancy can lead to complications. Discussing your medication regimen, nutrition, and overall health with your doctor is crucial before planning a pregnancy. Tips for boosting fertility with IBD. Now that we've covered the challenges, here are some tips to help you boost your fertility while managing IBD. Stay in remission. If you're in remission, your chances of conceiving are significantly higher. Work with your healthcare team to ensure your disease is under control. Consider surgery timing. If surgery is necessary, timing it appropriately in relation to your fertility goals is important. Talk to your doctor about the best time to undergo surgery to optimize your chances of conception. Eat a fertility-boosting diet. A balanced diet rich in essential nutrients like folate, iron, and zinc is critical for reproductive health. Consider supplementing where necessary and work with a dietitian to optimize your nutrition. Manage stress. Techniques like yoga, meditation, and mindfulness can reduce stress and inflammation, supporting both your fertility and overall health. Be patient. Getting pregnant with IBD can take longer than expected, so don't get discouraged. If conception is taking longer than you'd hoped, don't hesitate to reach out to a fertility specialist for guidance. Fertility and IBD is a topic that's often not discussed enough, but it's so important. I hope this video has shed some light on the impact of IBD on fertility and provided you with useful tips for improving your chances of conceiving. If you've experienced challenges with fertility and IBD, I'd love to hear from